I'm excited to be here, and I'm excited that we have such a crowd interested in aesthetics. I'm going to talk about energy-based devices for the face. Let's see. I have a couple of disclosures and a little bit about me, just a little. And so the most important things here, I think, for you are the top two that I founded one of the first independent vein surgery centers in the country a long time ago, back after the very first IVC. And I added a year later aesthetics. And over the period of time between then and now, the aesthetics has just grown and grown. And even though the veins grew, aesthetics grew faster and just kind of devoured it. And I stopped taking insurance and stopped doing veins for the most part about 3 years ago. I do a few every now and then, but it's all for cash now because I was losing money. So a little bit more. So energy-based aesthetic treatments. 3 things. What are they? Do you need them? And if so, which ones? So a little bit about aesthetics and its growth. Prior to 2015, the growth rate was from about 2008 on, about 20%. This is the growth rate. It's still a huge industry, right? But it plateaued, and then it started to decrease growth. So it's still growing, just at a slower rate, because we've got a lot of competition, and we've seen a lot of innovation in the market, but it's really just another device to replace a device that's already there that does a good job anyway. A lot of companies out there want you to work for them. And when you buy big fancy devices with a lot of disposables, you're paying the third party, or you're paying the middleman frequently. So another thing that I like to talk about is limiting that so that we put more in we might increase our revenue, but we got to keep that overhead low too. It's really easy to get into a pickle with this. So importantly, all right, energy-based devices. What are they? It's a device, could be handheld, could be a big ass box, but they all have energy, right? So light or laser energy, radio frequency energy, ultrasound energy, cold, heat, plasma, ohmic. So lots of different forms of energy and lots of different devices. It's a very confusing world. So why do we use them? We use them for tissue remodeling. That could be improving the quality of the skin, the aging skin or the sun-damaged skin, building back elasticity, collagen, elastin, glucosaminoglycans, all those things. Improving laxity, the fibroseptal network underneath the skin, and strengthening the fascia even. We can get down to the fascia with some of these devices. We can treat color, browns and reds being the vessels, and browns being usually the solar lentigines and other melasma and other brown discolorations. We can reduce fat and remove hair. So, considerations, your market, number one. If you currently have a patient database, which I assume you do if you're in this room, you can mine that database and take the patients that you've been improving the appearance of their legs and the quality of their lives, you've got their trust, and you offer, like Candy said, while you're doing a sclerotherapy session, you talk about, hey, we can take care of those brown spots there, and that's going to be even better because once we get rid of all these leg veins, you're just going to see a bunch of brown spots on your legs. So your opportunity is there. Look at your market, your staff. We talked a little bit about the quality of your staff, the training of your staff, the appearance of your staff, and each state has different statutes on who you can hire to deliver these services. In some states, your esthetician can do a laser treatment or a laser resurfacing type treatment. In other states, it takes a mid-level or even a physician. So you got to look at your state statutes, your demographic. Here in South Florida, you've got a lot of skin types 4, 5, so you have to consider ethnicity, the skin type of your demographic, what else you offer, the cost of the device and the warranty and the disposables. All right, a little bit of, these are my patients. I've done this for years and years. For 26 years, I've been doing ablative and fractional laser resurfacing with a carbon dioxide laser. That's my go-to. So who can operate it? That's your highly skilled and trained personnel in the office. It could be a mid-level depending on the state, but I do these as far as the deep ones go. So you can get these devices pretty cheap relative to the cost of most energy devices in aesthetics these days. So my device is about a $40,000 device, and it is a workhorse, no disposables. The time of the patient's in the office, maybe 90 minutes. It takes me about 45 to do a really good, deep laser resurfacing. But I charge $3,200 to do the full face and neck and no disposables. and a pretty cheap device. It's great, and look at the results. Vascular laser, you guys are familiar with this already, I'm sure. I use an old Dornier, like a 2003 bot, that has a little handpiece, and so this fellow up on the top, that is a Dornier treat. All of these are, actually. See the see the one on the lower right? That little vessel around the eye? You get a lot of those. Never sclerose them, and they're a pain in the butt to do a phlebectomy on. But you can treat them with a good laser hair removal. I say moderately skilled here because you can really hurt somebody with laser hair removal. So you really have to train these employees well. The devices can be somewhat expensive. Time in the office totally depends on what you're treating, but and treatment time as well, obviously. And the charges aren't great, but you have multiple treatments and typically someone other than you doing the treatment. IPL, broadband light, this is a brown spot. Again, I call it highly skilled here only because they just have to be trained really well not to hurt somebody. You need results without complications. Safety first. Devices can be expensive. Again, no disposables, time in the office, charges. We charge $450 to $550 for a full face, but it's pretty quick treatment. They need about 2 or 3 typically. RF microneedling, moderately skilled. This is a pretty easy treatment to deliver. Again, the device isn't cheap. There is a disposable. It's about $100. You got to use a good topical anesthetic, which is not cheap too. Time in the office accounts for a lot of sitting numbing time, and then we charge anywhere from, if we do a full face and neck, it's $2,000 per treatment for 3 treatments, about a month apart. I treat scars. See the upper left scar? It's about 6 years old. So I treated that with RF microneedling, added a little growth factor solution to it, but look at that result. It's amazing. People pay will pay for that. Again, it's a $100 disposable. I do radiofrequency assisted lipo for the lower face and neck with really amazing results. I call it highly skilled because it's me who does it. Device isn't cheap. Disposable's pretty cheap. I charge about $11,000 for it. Takes me about, I don't know, I spend about an hour or so treating the patient, but they're in the office for pre and post care. Here's another one. This is a post-op day 1. No bruising. It's so cool because the radiofrequency energy seals the vessels. You do a laser-assisted lipo. So same deal there. Non-invasive RF, there are forms of radiofrequency treatment that can be used by your low-skilled people in the office that do not go through the skin or pierce the skin. There's a little wand that's used to preheat the deeper tissue to stimulate collagen formation. This is a focused ultrasound treatment on the forehead. Look at the lid show, before and after. So it's a 15-minute treatment, literally. I charge $900. The disposable is about $50. You can get the device pretty cheap, more on that lower end there, but it's a great treatment that I do at least once a year on almost all patients. Submental fat, and I'm at the end, so I hope I answered your questions on what are they, do you need them, and if so, which